All right. Well, welcome everyone to tonight's injury prevention webinar with Athletico Physical Therapy. We have Karen Shanahan, facility manager here in Lake in the Hills, Illinois, with us tonight. She's going to be talking about all things injury prevention with us this evening, which is obviously a very relevant topic for those of you who are on this webinar this evening, as most of you are training for a fall marathon, in particular the Chicago Marathon or New York City Marathon. Unfortunately, running has a very high injury percentage across all runners. It's a crazy, ridiculous percentage of people that get hurt running because running is a contact sport, if you think about it. So we are going to talk about a lot of the common injuries that runners experience, how we can try to avoid those. And then certainly if you are currently dealing with an injury, now's the time to ask. Karen's an expert in these topics, so you'll want to ask her any questions that you might have. Before we formally turn it over to Karen and let her delve into her presentation, I just want to do a quick introduction of Karen and her bio. Karen has worked for Athletico for 13 years now. Like I said, she's currently the facility manager for the Lake in the Hills Clinic, which is where I am based. It's a far northwest suburb of Chicago. She received her undergraduate degree at North Central College in Naperville, Illinois, a bachelor's in athletic training, and went on to graduate school at the University of Illinois at Chicago, where she received a doctorate in physical therapy. She enjoys running. She's completed over 50 half marathons, 5 marathons, very active in the triathlon scene, numerous sprint and Olympic distance finishes, 12 half Ironman finishes, and a full Ironman finish, which is crazy, which is very, very impressive. And she definitely enjoys working with and treating endurance athletes. She has a passion for that type of patient. So did I miss anything, Karen?
That's good. Thank you, Seth.
That's great. So without further ado, I will introduce everybody to Karen Shanahan. I want to thank you for leading this presentation tonight, and I will turn it over to you.
All right. Did you have the slides up? There we go. So thank you all for jumping on the call here. You guys have started the first part of marathon training. You did the big thing of signing up. You got involved with a running coach and a training group with Seth and Kopf running, and hopefully you're beginning to start running and running and running. And unfortunately, sometimes you get hurt. Ideally, and ideal world, you wouldn't get hurt, but like Seth said, unfortunately, running does come with a high incidence of injuries, especially if you're unprepared. So hopefully we can get you through to that race day with minimal, if no, injuries. With running, there's a lot of risk factors that can increase your incidence for getting a running injury. Some of the most common things are abrupt increases in mileage. So going from running nothing to increasing, and deciding you're going to go run 5-10 miles. Having a previous injury or trying to come back too soon from an injury. If you have less experience, you're more likely to get injured as well, and that's experience within running and endurance events. And then if you're trying to be too competitive, if you're trying to, best your time from 20 years ago, or if you're really competing and getting competitive with other runners within your group. Other contributing factors to injuries are age, either those who are very young or those who are a little bit older. Running shoes, if you have improperly fitted running shoes, or even if the running shoes are properly fitted, if they're a little bit older and a little bit worn down. Your BMI, and that's your body mass index. Unfortunately, the more you weigh, the more impact, the more loading is going to happen as you're running, and that can increase incidence of injury. Gender, some things are a little bit more common for males versus females, or females versus males. The type of terrain that you're running on, if you're running on uneven ground or trails versus hard surfaces. Inflexibility, so if you're just someone who has a really hard time touching their toes, someone who is very tight overall. If there's strength imbalances, which we'll kind of talk about a little bit more later as well. And like we said before, your overall running experience. If you're someone who, let's say, is an avid swimmer or someone who played tennis, distance running is different than that. Even though you could be a great athlete, distance running uses different muscles, so that experience of running specifically. With running, there's a whole slew of different injuries that people can get. I'm going to talk about the top kind of 6 ones that people tend to experience in endurance and specifically marathon training. Plantar fasciitis, Achilles tendonitis, shin splints, patellofemoral pain syndrome or runner's knee, iliotibial band syndrome, and hamstring injuries. So we'll start from the bottom and kind of work our way up. Plantar fasciitis is inflammation of the bottom tendons and plantar fascia of the foot, and that can occur with people who are have a high arch or who have flat feet. Each of those kind of pull on that arch and tug along that bottom of the heel and cause symptoms of dull, achy, or like a bruise type of pain that is in the heel and into the arch. Typically, this pain is worse first thing in the morning, those first few steps after you're getting out of bed or after you've been sitting for a long period of time. It tends to be pretty sore at the beginning of run, but once things loosen up, it tends to feel a little bit better. A lot of times this comes into play when the calf muscles on the back of your shin are very tight. Improper footwear, so if a shoe is not supportive enough or does not accommodate for your arch type. It can also be very common if you are increasing your mileage too quickly. And then other kind of less known causes are if you have tight hip flexors or a weak core or low back pain, that can actually contribute to changes in your stride that you'll wind up feeling in your feet. So, you know, this is one of those things, can you run through it? Yes, it kind of just depends on how bad it is. So if it's kind of constant pain that you're feeling throughout the day, whether you're running, whether you're sitting, whether you're standing, then you should stop running. But if it's only the first few steps in the morning, it loosens up pretty quickly, then you can push through it and run through some of that. Different things that you can do at home to kind of help with some of the self-management of this is you can do ice massage. You can take a water bottle and freeze it, put it on the floor and roll your foot over. You can also roll your foot over like a golf ball or a tennis ball as well to get some massage and really stretch out the plantar fascia at the bottom of the foot. I always recommend for people who have plantar fasciitis to make sure they get evaluation of their shoes and of their footwear, you know, whether that's at a good running store or whether that's with a physician or a physical therapist. The reason for that is a good fitting shoe should feel comfortable from the beginning. You shouldn't really have a big break-in period. Sometimes there are orthotics that can help with that. If you have a really flat foot, the orthotic can put a little bit more support in that arch area, so there's less of a pull there. There's also something that's called a Strasbourg sock. It's actually like a sock that you can put on at night that actually helps pull your toes towards you to give a nice prolonged stretch to those calf muscles throughout the night. Doing calf stretches throughout the day, you know, first thing in the morning when you wake up, before you're running, after you're running, that can help out. And doing a lot of core strengthening, like I said before, tightness in the hip flexors and weak core and back pain can alter your stride because you're trying to compensate for that weakness. And doing some of those strengthening exercises can help decrease that.
And we had a few people jump on while Karen was talking. So feel free to type any questions you have in the little chat box, and Karen will get those answered in a timely manner.
So the next one is Achilles tendonitis. So that is, if we're kind of moving up the ankle a little bit more, it's the Achilles tendon is that part of the calf muscles that attaches into the heel, kind of right at the base of the heel. Most of the time, people will feel pain in the lower calf or back of the ankle. Sometimes, if you're running, especially if you're doing acceleration drills, or if you're really trying to get a really hard push-off, I think suicide drills from back in gym class, that type of sharp pain that causes swelling, bruising, immediate deformity in the back of the ankle, that would be something that you want to go see the doctor right away. That is not something that you want to push through at all. If it's more tendonitis, more that overuse of those muscles, the overuse of that tendon where it breaks down a little bit, that is something that is one of those borderline things. You can sometimes train through that, if it's no pain when you're touching the back of the tendon, and if it gradually loosens up after some stretching, then you can try running through that. If you're starting to get pain with rest and it lingers after activity, then you definitely want to proceed with a little bit more caution. Typical causes for tendonitis, the overuse of that Achilles tendon, is dramatic increases in your training, especially if you're adding in hills or speed work. Like I said, that rapid push-off, that rapid acceleration can really contribute to the injury. And in the calf muscle, and also weakness in the calf muscles. If the calf muscles are weak, and have that force needed to push off. Treatment for this, rest, decreasing your running mileage and the intensity, trying to go a little bit more easy runs as opposed to doing a lot of speed work. Icing, working on strengthening those calf muscles. So eccentric heel raises is working on kind of that lowering portion. So if you're pushing up onto your toes, kind of slowly lowering down, or you can push up with 2 feet and actually just drop your heel on 1 foot. And then compression sleeves and socks can help out as well, just to keep that area nice and warm, keep that blood flow going through there, and decrease swelling that can occur in that area. Shin splints are, the technical term for them is medial tibial syndrome. And what that is pretty much there's some little micro tears that occur on muscles around the front of your tibia, your shin bone. And this is another common injury when you are either new to running or returning to running after a long period of time. If you have a rapid increase in your mileage, if you're wearing old shoes that aren't supportive, that aren't taking that shock absorption. If you're hard overpronation, or kind of when your foot flattens too much when you're running and when you're standing on it, can also contribute to symptoms as well. Shin splints feel like an aching and a soreness along either the inside or the outside of the shin bone. They tend to be the beginning of run, eases up a little bit, and increases soreness after. If you're feeling a lot of tenderness, one specific spot, if you're having, you try on one leg, or you're having pain throughout, that's something that you want to stop. Sometimes those the fence can actually end up being a stress fracture, and that's something you definitely want to avoid running on, want to seek treatment for right away in order to avoid winding up with a full fracture of your tibia. Stretch muscles on the front of the leg and in the calf. Potentially doing different shoes, having that shoe evaluation from a good running store, or input from a physician or a physical therapist. Trying to run on softer surfaces, so trying to avoid running on the trails, like trails, to minimize the amount of impact that the hard surface has on there. Crossing the exercises. The big thing too is just really making sure that when you're increasing your mileage, you're following a training plan. One of the things you want to make sure is that you never increase your long run mileage by more than 10% per week. And this is to allow that body to accommodate to that increased load. Every time that you are running and every time your foot hits the ground, there's actually increased stress on those joints, not only in your feet, but all the way up, your leg, your knee, your hips.
Hey, Karen.
Mm-hmm.
I have a quick note here. I'm getting some interference on my end. For those of you who are on listening, if you're getting some interference on your end and you're finding it difficult to hear what Karen's saying, just type yes and press enter in the chat. Okay. Yeah. Heidi and Elle, they say yes. So a quick pause here. I'm almost wondering if it would be worth, Karen, you jumping off and then jumping back on.
Do you want me to do that?
Let's try it. Yeah, because it's we're getting some interference, so sometimes you're crystal clear, and other times it's hard to make out.
Okay, let me jump off and I'll jump right back on.
Okay, thanks, Karen. And sorry, guys, for the interruption here. I just want to make sure that we're getting all this good information, and we're able to hear it.
Is this better at all?
Well, that sounds great. So let's hopefully that'll stay.
Okay, let me know if it doesn't.
Awesome. Thanks, Karen.
All right, patellofemoral pain syndrome. It's also known as runner's knee. And that is when you feel symptoms of achiness and pain underneath the kneecap. Typically tends to be worse with stairs, especially going downstairs, worse with downhill running. And a lot of times you get some stiffness and tightness when you're sitting for long periods of time, especially things like on an airplane where you don't have much space to move around. Different causes for runner's knee is direct trauma if you fall on your knee, muscle imbalance when the quads are too tight or too strong. A lot of times that can put increased pressure on that patella, that kneecap. If you're doing, like all these injuries, overuse when you're trying to increase your mileage too soon, that can be a big factor. And then a lot of times too, that excessive pronation, that excessive rolling in of the foot, that can put increased stress on the knee. It can actually cause the knee to kind of dive in a little bit, put more pressure on that inside of the knee. Things to avoid, would be not only increasing that mileage too soon, but avoiding the downhill running, just to minimize that amount of impact. Icing and stretching can definitely help. There's some different taping techniques, a more rigid tape like a McConnell tape, a more flexible tape like kinesio tape. The kinesio tape tends to be one that a lot of people recognize from the Olympics, the multicolored tape on there. Increasing the cadence, trying to increase the turnover of your feet so you're moving a little bit quicker, but also shortening your strides. So your feet are moving quicker and you're not taking those big loping strides. You're kind of shortening up a little bit so that your foot is actually landing a little bit more underneath your knee. Iliotibial or IT band syndrome is pain and tightness, typically along the outside of the knee. Can have some symptoms when you have IT band tightness that's a little bit higher up, closer to your hip, but most of the time you're going to feel it right on the outside of your knee, kind of that bony part on the outside. As you're running, you're flexing and extending your knee, which causes that IT band to rub on that outside of that bump on the outside of your leg, your femoral condyle there. It especially gets irritated when you're increasing your mileage too quickly. When you have a lot of weakness in your hips, especially those abductor muscles on the outside muscles of your hip. And same thing like we were talking about with patellofemoral pain syndrome. If you overpronate, your kind of knee dives in a little bit. That puts an increased strain on not only the inside of your knee, but the outside of your knee by the IT band as well. A lot of times if you're doing a lot of downhill running or excessive speed work, that can increase the irritation of the IT band as well. Running on banked surfaces, so kind of if you have a road that you're running on the side of and you're always running, you know, where your right leg's hitting a little bit lower than your left leg, that can cause these symptoms. If you're running on a bank and you're doing circles in the same direction all the time. Treatment for this: rest, ice, doing stretching, trying to run on softer surfaces, making sure that you're not running on those bank surfaces or turning in the same direction all the time if you're doing a lot of track work, or even if you're doing, you know, a trail or you know, a shorter loop on the road. Really a big thing for IT band syndrome. It's not only the stretching, but it's really diving down to the underlying problem, which typically tends to be weakness in the core and the glutes and those outside muscles on your hips. So really focusing on strengthening those can limit the symptoms and decrease the intensity. The other thing, just like the patellofemoral pain syndrome, shortening the stride, trying to have a little bit quicker turnover of your feet, that can minimize that as well. The picture actually shows someone with a very long stride, so you want to kind of try and shorten that stride up a little bit more, so your foot's striking the ground a little bit closer to directly underneath your knee and your hip. Hamstring injuries, there can be a myriad of different hamstring injuries. You can have a tear in your hamstring, and that's typically when you tend to feel that sudden acute pain. A lot of times it's accompanied with bruising along the back of your thigh. If you get that, you definitely want to stop, you know, especially if you hear a snap or a pop while you're running, and seek some medical treatment. That is a little bit more serious than some of the other nagging hamstring strains and tendonitis. If you do have any type of hamstring injuries, unfortunately, they kind of tend to take a while to heal, especially if you're pushing too much. You want to make sure that you're kind of slowing down, taking those rest days. You definitely want to make sure that you're avoiding, you know, interval workouts or speed workouts, things like hill repeats, making sure you kind of have a slow, steady, easy pace, cross train if need be to keep up your cardio endurance. Hamstring injuries that can be caused by either too tight of hamstrings or hamstrings that are too flexible. So kind of taking a look at your overall flexibility, seeing which one it is for you. A lot of times there's a big muscle imbalance, and the quad muscles tend to be stronger than the hamstring muscles. So the hamstring muscles have to work harder to kind of create that balance when you're running. So strengthening those hamstrings can help out with that as well. So there's not an exact slide on this, but you know, with all these injuries, there's kind of a little myriad of almost like a spectrum of injury. You can have a, you know, severe full-blown injury where you need to stop, completely shut down, you know, definitely need to go to the doctor, and you need to have time off from running. The complete other end is, you know, kind of the green zone. You're feeling pretty good, no real injuries. If you have something, you know, maybe you feel a little twinge at the end of a long run, it's gone by the end of the day. You're not feeling anything the next day. Unfortunately, what kind of falls in for most runners at some point during marathon training, they're kind of in that, almost like that yellow zone. They're feeling a little bit that bugs you. It's not quite getting better. You can run through a lot of it, but if you don't kind of treat some of the underlying causes of it, if you don't correct some of those muscle imbalances, those tightnesses and weaknesses in the different areas, then that can kind of push you more towards the red zone. A lot of times with running and a lot of times with injury, there is, you have to make the decision to take a little time off now or a lot of time off later. I know a lot of people, especially early on in marathon training, if they miss that long run, they don't think they're ever going to catch up. But there's time built into, most training programs. There's that gradual increase in mileage and then the little drop off, that gradual increase in mileage and that drop off, that graduated progression of mileage can help minimize the amount of strain on the body. And it also gives time, if there is some type of injury or some type of nagging pain, a chance to heal before the next long run. So I always tell people that, unfortunately, when things like that happen, you got to do your homework. With running, you do get running homework. There's the strength training and the stretching and, foam rolling and things like that nobody necessarily wants to do, but the issue will come back if you don't. So why do you strength train? Big things are, decreasing the muscular imbalances, improving the muscle endurance. When you're distance running, if you can do a squat max and that's great, but if you can't do 30 squats, your body's not going to be able to hold up as well for the extended mileage. You want to improve your running efficiency. The more efficient you are at running, the less energy it takes, the longer you can run, the less fatigued you can get, which is always a good thing. And it can decrease the incidence of injuries. Like I said, you could max out on a 1-rep squat and, you could not be an efficient runner. You cannot be able to do the endurance running. With strength training, we're not worried about that 1-rep max at all. We're worried a little bit more on the low resistance, high repetitions, because that's more mimics what the needs of running are. You don't have to do a ton of strength training. I tell people 2 to 3 times a week. Most of the time, if I say 2 to 3 times a week, if they 2 times a week, that's good. I know it takes some time, but you don't have to do a 2-hour strength training session. If you do 20, 30 minutes a few times a week, that can be extremely beneficial. With any type of strength training, you want to really make sure that you're maintaining good form. You want to make sure that you're focused on the quality of the exercise and the movement as opposed to the quantity or the amount of weight. Majority of exercises that I recommend are pretty much body weight exercises, sometimes using a ball or maybe a resistance band, but you don't need any fancy equipment. They're exercises I always tell people, you can do in front of the TV, that's fine, as long as you have, some awareness of your form and, you're paying a little bit of attention to what you're doing. I listed a bunch of examples of exercises. A lot of them are kind of my go-to exercises for runners to work on, the big things that tend to be weak with distance runners. Majority of distance running is kind of in a straight line. You're going forward, forward, forward. So you're not using those muscles on the side of your hips as much. You're not using them to help to change direction at all. But what happens is when you're running, everything is kind of, you're going from one leg to the other. You're going from one single leg stance to the next single leg stance as you're advancing and you're running. And in order to maintain that stability in your pelvis, in order to maintain that control, you're actually needing to activate those hip muscles, those core muscles, in order to hold those hips and that pelvis in a good neutral position. So a lot of the exercises that we recommend with strength training is to build up the muscles in the glutes and in the core. So things like sideline clams, where you lay on your side, kind of with your knees bent and your feet together, and you kind of bring your knees apart, almost like a clamshell opening and closing. And you can do that without weight. You can add a resistance band around your legs. Lateral band walks, putting a band around your legs, doing side stepping. That can, same thing, really work on those outside muscles of the hip. I always like to add standing kicks to those, you know, forward, sideways, and backwards with that band around. It's kind of a two-part exercise. First part is, you know, you're standing on one leg, so the leg that you're standing on gets a lot of stabilization work in the hips muscles. And then the leg you're kicking with is obviously kicking against a little resistance, or you can even do it without a resistance band, and works on the strength on that as well. Balancing on one leg, like I said, a lot of running is, or all of running is kind of that single limb. You're going from your right leg to your left leg, you know, switching back and forth constantly. Doing core work, you know, working on planks, not only kind of prone, kind of on your stomach planks, but on your side as well. Doing things like Russian twists, where you're sitting most of the time feet up in the air and kind of rotating your trunk from side to side. Working on heel raises and toe raises to really get that push off. You know, as you're pushing off the ground, you really want to kind of have a little bit of that explosive power. And it also helps really prevent and treat a lot of those shin splint, Achilles tendonitis, plantar fasciitis type of injuries. Doing lunges, I always like to do a variety of lunges, you know, forward, backwards, sideways. You can do kind of diagonal lunges. You can do lunges where you're holding a medicine ball and twisting from side to side to activate that core a little bit more. That works a lot on running. It's kind of like a modified lunge position, so really working on driving that leg forward. It also works on that transitioning from one foot to the other foot as you're stepping into there. Working on squats, especially if you can do them, single leg squats, because like I said, everything that you're doing with running is on one leg. Deadlifts, so two leg or one leg, you know, standing with your legs straight and kind of bending forward, focusing on making sure that your back stays nice and straight. And doing things like bridges, where you're laying on your back. You can have your knees bent up and your feet on the ground and lifting your hips up, or you can put your feet on a ball and bridge up in that position as well. So those are just some ideas of different things that tend to be pretty basic, but really give you a lot of good benefits for a variety of different injuries, especially those ones that we talked about earlier, those kind of 6 big ones. The other thing you want to make sure is that you're really participating in doing a stretching or foam rolling program. A lot of the muscle tightness that you get, you know, throughout the day, especially since so many people have jobs where they're sitting for long periods of time, or they have long commutes and they're sitting in the car, those muscles get really tight. So making sure that, you know, if, let's say you get home from work, you've sat all day, you had an hour commute sitting in the car, you want to make sure that you're warming up those muscles so they're ready to go running. So performing dynamic warm-up, some type of walking or light jog or some dynamic stretches before you run can be very beneficial. Where you want to get those flexibility gains for those muscles that are tight is actually, you want to do it post-run. This is when the muscles are already warmed up. You're going to hold these stretches for a longer period of time, for 30 to 60 seconds. And as you're holding them, you want to hold it in that one position. You want to make sure that you're not bouncing at all. That can increase the amount of strain on the muscle. You want to just hold them for a nice controlled motion. Foam rolling can be very beneficial. It can be kind of like a self-myofascial release, a self-massage or trigger point release. That can be done after you're done running as well, or after you're doing a strength workout. Typically, we tell people to foam roll 1 to 5 minutes per muscle group, depending on how tight things are, how much intensity it is. The other thing that can be beneficial is going and getting massages, especially if you're someone who is coming back from an injury, or someone who tends to have a lot of tension and tightness in different areas of their body. So kind of big injury prevention tips overall. You know, we kind of talked about specific things for specific injuries. But I mean, listen to your body is the number one. You know your body, you know when things hurt. You know kind of in your gut when you should stop and hold off. You know when something's wrong. So actually listen to yourself. You want to follow a training program. You don't want to just kind of randomly be like, oh, I'm going to run 10 miles today. I'm going to run 7 tomorrow. You know, you want to follow that structured training program that's going to allow you to advance those runs and allow your body to become accustomed to the increased distance and the increased pounding on the ground. So, you know, make sure you're paying attention to what Seth is saying, or making sure that you're paying attention to your other running coaches. You don't want to increase that mileage too quickly, like we talked about before. You don't want to increase it by more than 10% per week. Rest days are okay. They're definitely encouraged, especially if you're starting to feel something. So if, let's say, you're on a run and you start to feel some pain in your knee or on the IT band, you want to take a couple days off. You want to make sure that you're doing those rest, ice, stretching, starting to do some of those strengthening exercises. Make sure things are calmed down. If you go and just start to continue to run on it, continue to build mileage on it, that injury can, you know, instead of taking a day or two off right after you're feeling it, you could be off for a few weeks to recover from it. And kind of in regards to that, cross training, using like an elliptical, cycling, swimming, those are all good alternatives to avoid some of that pounding and some of that impact on the ground, especially if you are recovering from something, or if you're just not feeling as good as you think you should, if you're feeling a little bit more fatigued. Make sure that you get good running shoes. Another thing I always recommend is make sure that you're not going to have running shoes that are, you know, ready to be replaced a week before race day. You want to have, you know, timed out that you're breaking in those new running shoes. You're making sure that, you know, if you got a new model or something like that, that it fits good and it feels comfortable on those long runs. So kind of plan ahead. Some people will get 2 pairs of running shoes and kind of alternate back and forth between theirs. That can help out, or, you know, making sure that if you do need new shoes, you're getting them, you know, a month before the marathon so that you can make sure everything's good with them. You're not having any issues. Like I said, do your running homework, stretch, foam roll, do your strengthening exercises. It can be a pain, but if you don't do it, you're more likely to become injured or more likely to have to take additional time off if you are unfortunately injured. Icing can help reduce pain and inflammation. You know, there's a lot of pounding on your joints as you're going through the mileage, so feel free to use that to help. I already said before, address any of the injuries early, you know, take a few days off if needed. The other thing too is you can always get like a video gait analysis and have someone watch your running form and see if there's anything that they can see that, you know, kind of tweaking your running style a little bit that can potentially help address any issues. So things like shortening your stride length, increasing your cadence, you know, making sure that your hips aren't dropping when you're running, that can help out as well. So at Athletico, we're here to help. You know, we do offer free injury screenings that work out. So you just call, schedule an appointment at any one of our locations. It is complimentary, and a physical therapist or athletic trainer or occupational therapist will take a look at you, kind of do a mini assessment, and kind of either give you some advice in terms of, hey, you know, why don't you work on these couple stretches, these couple strengthening exercises, see if it goes away. Or if it's something a little bit more severe, it can help direct you in the right direction in terms of getting you seen by a physician and making sure that nothing more serious is going on. So I think I talked pretty quick, but anyone have any questions?
And then I would say too, just to add on to that, that if you do not live near an Athletico, a lot of times physical therapists, they will offer complimentary injury screens. So if you can't get into an Athletico because there's not one nearby, don't let that stop you from reaching out for help.
I definitely agree with that.
Yeah.
And, you know, there's something, you know, I may know someone in the area that you live in if that comes up, or if it's something that, you know, my contact information is at the end of this presentation, but you can always reach out and I can try and help direct you in the right direction in terms of giving you the help that you need if you're not close by to any Athleticos.
So that's to piggyback off of that. That's super key. Obviously, Karen's information is here. This is being recorded, so this will be made available to everybody. But yeah, if you don't live in an Athletico service area, um, please feel free. You know, Karen's well connected throughout the industry, so like she said, she can get you connected. But if you're dealing with an injury or you feel one that's coming on, obviously, feel free to reach out to Karen. You can reach out to me, but it's one of those things that you certainly don't want to ignore. And then, you know, if there's not any immediate questions, I'll just bring up a couple points here. Maybe this will spark something, but I think that this is worth noting. A few things that Karen mentioned, and all of you by now know and have seen your training programs, but you know, one thing that she mentioned was the importance of a warm up, doing a dynamic warm up, and not necessarily doing the static stretching before your runs. That's actually been shown that it does more harm than good before an activity like running. So do your dynamic warm-ups, do your active cool downs. So we want to sandwich those workouts. So we have a warm-up, we have a workout, and then we have a cool down. And I like to always say, and I know Karen feels strongly the same, that strength work is a need to do, not a nice to do. So those strength workout routines that were sent and built into the training programs, you always want to do those. So 2 to 3 times a week is actually what I prescribed on most of the programs, which is what Karen suggests. So we're in accordance there. And you want to do those after your runs, just to not jeopardize the runs. And I think what I'll do, and I think it would be helpful if those listening right now aren't quite sure what cadence means. I guess first, I'll let maybe Karen explain that a little bit more in depth. And then two, when I send out a recap of this, I'll also include a link to the Cadence app that I use on my phone that helps me.
So cadence is pretty much how many times your foot hits the ground as you're running. So if you think about it, the more times your foot hits the ground, there's more impact with there, throughout the joints. So ideal running cadence is, varies person to person, but it typically tends to be, we say kind of our gold standard is 180 steps per minute. Some people are going to be a little bit higher than that. Some people are going to be a little lower than that. So to determine that, pretty much every time, you can do it for like a minute. Every time your foot hits the ground in a minute, you would count. So some people just count every time the right foot hits the ground in that minute, and then just double it because your left foot's going to hit the ground. So like Seth mentioned, that there's a lot of different apps that have like a cadence tracker. There's different playlists that are kind of that 180 beats per minute for the songs, and that can be kind of a trigger every time you hear the beat or hear the noise of the cadence tracker. Then you want to make sure your foot's hitting the ground there, just to be efficient in your running. And your stride kind of piggybacks on that. The longer your stride is, if you have a really big loping stride or your feet are really far apart as they hit the ground, you have to take those big strides. That can decrease your cadence, and as you're shortening that stride length, it typically tends to increase your cadence.
Awesome. Thanks, Karen, for the explanation. I would encourage you, if anybody is dealing currently with an injury, and they do happen, even though we're just starting the second week of training for the Chicago Marathon, and then training starts for the New York City Marathon here in a couple weeks after the 4th of July. But if you're currently dealing with an injury, I strongly encourage you to type in the injury or what you're dealing with, and now would be a great time to chat with Karen about that. But let's give it another minute or two. Certainly no rush. So if you have a question, please do type that in. And yeah. And then if any of you are typing out, just to fill the time here again, I will be sending this recording out here in the next day or two. Um, so you'll obviously have Karen's email address. So again, strongly encourage you just to reach out. Like we mentioned at the beginning, she has an affinity for working with endurance athletes like yourselves. And so she has been a great resource to me personally and professionally. So I strongly encourage you to do that. It's always great to have as many resources in your back pocket as you possibly can when you're trying to tackle the 26.2 mile challenge that we all are doing here. So it doesn't look like, Karen, anybody has any immediate questions. Um, as always, if you're like me, I get off of these things. I think to myself, oh gosh, I had two questions that I wanted to ask and completely spaced on that. So if you have any questions, please feel free to email Karen directly, or you certainly have my email address. You can email me, and I can take a stab at the question, or certainly connect you with Karen. But I do want to just say, as a note, to also mark your calendars. We will be back here again next Tuesday night, same time, 6:30 Central. We will be doing a marathon nutrition webinar with Tom Jordan, who is our resident dietitian at Kopf Running. So we'll be talking all things nutrition. So that's something that you certainly don't want to miss either. But in closing, Karen, I just want to say thank you for doing this. Thank you for sharing your expertise. And yeah, just very grateful and thank you. And if anybody has any questions for you and they reach out to me, I'll make sure to get them in contact with you.
Thank you guys for listening, and definitely good luck in marathon training. And I hope you guys all have a injury-free running season and a nice personal best at your marathon.
Awesome. Thanks, guys. Thank you to everybody attending. Thank you, Karen. Everybody have a good night.